Welcome. Today we're diving into the world of esophageal motility disorders, a group of conditions that affect the esophagus's ability to move food and liquids down to the stomach. We'll explore what causes these disorders, how they impact your body, and what can be done to manage them. So what exactly causes these motility problems? The etiology is often complex and multifactorial. In some cases, the cause is unknown, and we call these idiopathic. However, several factors are known to contribute. These include nerve or muscle damage within the esophagus, which can be caused by diseases like diabetes, autoimmune conditions such as scleroderma and lupus, and even infections. Certain medications can also impact esophageal motility. Additionally, esophageal spasms can sometimes be linked to stress or anxiety. Let's delve into the pathophysiology. The esophagus relies on coordinated muscle contractions, called peristalsis, to efficiently transport food. Esophageal motility disorders disrupt this process. This disruption can manifest in several ways. The muscles may contract too forcefully at hypercontractility, not forcefully enough hypocontractility, or in an uncoordinated manner, preventing the food from moving smoothly. Some disorders affect the lower esophageal sphincter, the valve between the esophagus and stomach, causing it to either not relax properly or to relax inappropriately, leading to reflux and other issues. This dysfunction leads to the symptoms we'll discuss shortly, like difficulty swallowing, chest pain, and heartburn. Epidemiologically, esophageal motility disorders are relatively common, but the exact prevalence is difficult to pinpoint due to overlapping symptoms with other conditions like GRD. They can affect people of all ages, but some disorders, such as achalasia, tend to be diagnosed more frequently in middle age. Other conditions like diffuse esophageal spasm may present more frequently in older adults. Factors like geographic location and access to healthcare can also influence reported cases. Now, let's discuss the signs and symptoms. These can vary depending on the specific type of disorder, but some common complaints include dysphagia, which is difficulty swallowing, odynophagia, or painful swallowing, chest pain that can sometimes mimic heart problems, heartburn and regurgitation of food or stomach acid, and a sensation of food getting stuck in the esophagus. Some individuals may also experience coughing, wheezing, or hoarseness, particularly at night, due to reflux. The severity and frequency of these symptoms can range from mild and occasional to severe and debilitating. Diagnosing esophageal motility disorders typically involves a combination of tests. One common test is esophageal manometry, which measures the pressure and coordination of muscle contractions in the esophagus. Another useful tool is a barium swallow study, where you swallow a barium containing liquid, and X-rays are taken to visualize the esophagus and how it functions during swallowing. Endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus, can help rule out other potential causes of symptoms, like inflammation or structural abnormalities. Additionally, pH monitoring can assess the amount of acid reflux into the esophagus. Esophageal motility disorders are classified based on the specific patterns of muscle dysfunction detected during testing. Some of the more common types include achalasia, characterized by impaired relaxation of the lower esophageal sphincter. Diffuse esophageal spasm involves uncoordinated and sometimes forceful contractions of the esophageal muscles. Nutcracker esophagus, also known as hypertensive peristalsis, is characterized by extremely forceful contractions. And finally, ineffective esophageal motility, where the contractions are weak and unable to effectively propel food down the esophagus. Treatment and management strategies depend on the specific type and severity of the disorder. For achalasia, options include pneumatic dilation, where a balloon is inflated in the lower esophageal sphincter to stretch it open, surgical myotomy, where the muscle fibers of the sphincter are cut, and medications like botulinum toxin injections to relax the sphincter. For diffuse esophageal spasm, treatments may include medications to relax the esophageal muscles, such as calcium channel blockers or nitrates. In some cases, therapies to address underlying anxiety or stress can also be beneficial. Diet and lifestyle modifications, like eating smaller meals and avoiding trigger foods, are crucial for managing symptoms in many individuals. Proton pump inhibitors, SPs, may be helpful to reduce acid reflux. Unfortunately, there's no guaranteed way to completely prevent esophageal motility disorders, particularly those with an unknown cause. However, certain lifestyle modifications can help reduce your risk and manage symptoms. These include maintaining a healthy weight, avoiding smoking and excessive alcohol consumption, and managing any underlying conditions like diabetes or autoimmune disorders. Identifying and avoiding trigger foods that exacerbate symptoms can also be beneficial. Practicing stress reduction techniques may help in some cases. The prognosis for esophageal motility disorders varies depending on the specific condition and the effectiveness of treatment. While these disorders are often chronic and require ongoing management, many individuals can achieve significant symptom relief and improved quality of life with appropriate medical care. Recent research focuses on developing more targeted therapies to address the underlying causes of these disorders. For example, advancements in minimally invasive surgical techniques are improving outcomes for achalasia. Furthermore, researchers are investigating the role of the gut microbiome and its influence on esophageal function.